cardiovascular system and all that good stuff? Yeah? So, Miss Yanas, you probably know this is coming because you were assigned first yesterday, so if it's all right, we'll go through in order. It's always better to go first, trust me. Miss Yanas, would you be so kind as to explain to us what anemia is?
So anemia is the lack of red blood cells or red blood cells that are dysfunctional. This causes reduced oxygen flow to the organs or the body's organs. Its symptoms include fatigue, dizziness, fast heartbeat, and unhealthy pale skin. It said that you can massage, but you should just ask your clients like if it's severe or not, because if it's not too bad, it's okay. But if it's worse, you should use lighter pressure. And I'm also assuming that you should give them a break before having them get up off the table, just because they get lightheadedness and dizziness from it. So you wouldn't want them fainting getting off your table. I didn't read that. I just figured that was probably a big concern.
Ms. Yanas, nothing makes me happier than what you said right now, because the fact is we don't know. All contraindications are really gray area, right? And we need you guys to be street smart. And that was street smart, where you said, nobody told me this, but obviously if they get lightheaded and dizzy really easily, I probably don't want to flip them off the table really quick, because the bigger concern is them passing out. And you didn't have to read that in the book. You just kind of put two and two together. Two and two together. You got four. And so thank you, because you guys are going to have to do that every day. Every day you're going to get a client, you're going to be like, Tapscott didn't tell me about this. That's because I never had that client before, and I didn't know. And they're like, I'm running a fever, but it's not really a fever. And there's this thing over here, and I've got to, and you have to kind of figure it out. There aren't hard and fast rules. So anyway, really quickly, you're 100% right. I assume you have nothing else to say because there really isn't much else to say about anemia. And there's all different types of causes of anemia, but it means you either don't have a lot of red blood cells or they're not doing a good job carrying oxygen. And so it's just like being oxygen deprived. So you feel lightheaded, you feel tired. These are things that happen when your heart beats faster. Why does your heart beat faster, everybody, when you have anemia?
Because there's less oxygen getting from the blood, so they have to make it faster.
Right. Your body senses it is starving to death from oxygen depletion, and so it's trying to beat the heart faster. It assumes if it gets going faster, it'll get more oxygen. It does help. And you might breathe heavier too, because you're trying to get more oxygen into your system. Yeah, your heart's just doing the best it can. It figures, well, there's not a lot of oxygen. I'm going to start pumping faster. Because that's what I do when there's oxygen is low. That's why when you run, your heart starts pumping faster because you need more oxygen. Yeah, well said. Cool. And there's no real major contraindications. Just be careful because they can get lightheaded very easy. Yeah, because again, they don't have a lot of oxygen going to their body. They're probably fine when they're laying on your table. And anemia, by the way, can also be caused by just lack of iron. Some people have really poor iron deficiencies and they give you some iron and it's fine. It depends on what it's coming from. Lots of people have iron-related anemia. You go to the doctor and he says, you need some iron supplements or whatever. Okay. Any questions about anemia? No. Yeah, I hear you. Okay. Ms. Torres, tell us about angina pectoris.
Okay.
Can you tell us what angina means?
What?
Can you tell us what angina means, by the way?
Angina means pain in the chest.
Yeah, angina means pain. Pectoris means chest, like pectoralis. So it's chest pain. Cool. Keep going.
Yes. And so it's pretty much that, pain in the chest. But you could also have some pain on your jaw or neck when it comes if it comes related to that. It could happen it happens because one or more heart arteries are narrow or blocked. Some of the symptoms are dizziness, fatigue, like lightheaded and swelling. There are 3 types of that, and it's like a coronary artery disease. Coronary. And yes, you could massage because it will help reduce the stress. And massage also helps decrease the the effects of symptomatic nervous system, and it could happen when you are exposed to extreme weather, like cold. So you always have to make sure the client is comfortable and is warm. But yeah, you could massage.
Cool. So everybody, angina means pain. You'll hear it with all sorts of stuff. And pectoris means your chest region. So this is chest pain. It can be associated, as Ms. Torres correctly said, it can be associated with heart problems, right? Certain types of heart disease where the heart muscle is weakened, or the blood vessels feeding the heart are partially clogged with things like cholesterol and stuff, and that can cause the heart to not function very well, and you can give you chest pain. That said, I suspect everybody in this class has had chest pain before. Yeah? Not? No? Never? Yeah, you can get chest pain from indigestion and such too. So just because somebody says I have chest pain doesn't mean that they're necessarily dying, because you probably all have had chest pain and you're still here. So the term itself really just means chest pain, and sometimes people use it very mildly, like, oh, I've just got a little bit of angina. They don't mean I'm having a heart attack. They mean I've just got a little bit of angina. I've got a stress-related thing or something. Ms. Torres is also really right that some angina is stress-related, and massage can help reduce the stress, which reduces the tightness in their chest. So has anybody here had, you don't have to raise your hand, but if you ever had an anxiety attack, one of the things that often happens is you feel very tight chest and you feel like you can't breathe. And the problem is when you feel like you have a very tight chest and you feel like you can't breathe, it makes your chest tighten, it makes it hard to breathe, which freaks you out, which makes your chest tighten and makes it really hard to breathe, which really freaks you out, which makes your chest tighten and really hard to breathe, which gives you anxiety, which makes your chest tighten. I think we can see what's going on here. So anyway, massage can help with all that too. Just help to unwrap that stress. Very good. Okay. Miss Stanley, you're up next with arterial sclerosis. Miss Stanley, take it away, and please say it better than I did.
I can't promise that.
Okay.
So, atherosclerosis?
Yeah, you did better than me.
Okay. So, basically what that is there's plaque in the arteries, and it restricts blood flow and can even form blood clots. And basically what it's doing, it's affecting the atrial walls, and it's affecting, it's interfering with its ability to change in diameter. So sometimes like it can affect your blood pressure. So you end up getting really high blood pressure most of the time. And this disease is like a doorway to other diseases.
Yes.
Like you get this and you're like more than likely to get all these other ones. And there was a huge list of them. And I know one of them actually can be a stroke.
Mm-hmm.
But it was really hard to get a clear answer on whether or not you can massage somebody with this. The best thing I could say is if they have any sort of heart disease, you should have them get a doctor's note clearing that they can get it. And even then, if they have this problem and like a high blood pressure issue, you can't do like Swedish massages. You can't do like long effleurage. You got to do shorter stuff, and you should do it away from the heart instead of going towards the heart. Yeah.
I like your logic. I agree that the textbook answer would be like, be careful with people with heart disease. Massage, however, by the way, just so everybody, is probably not going to make it worse. It's a long shot on that. But that was very intelligent, what you said.
Yeah.
Essentially,
It's just better to check for their blood pressure too before you give them a massage.
Yes. However, are we more worried about high blood pressure or low blood pressure?
High blood pressure.
Yes, for my health I am, but during massage I'm actually more worried about low blood pressure.
Okay.
And here's why. When you have high blood pressure and you lay down on the massage table, it tends to drop. So your high blood pressure tends to do better on the massage table. And when you have low blood pressure and it drops more, you can get lightheaded.
Yeah.
Yeah, and that can be a problem because you can fall over when you get up from the massage. But anyway, you're absolutely right, by the way. High blood pressure is a huge killer. It's a problem. It's a big sign that there's other problems. You're absolutely right. So this is clogging of your arteries, and the problem is your arteries do two things when they clog. They don't get as much blood to your heart, and they can form clots inside them. Remember how your blood is self-sealing? Like I cut myself and it seals itself? You don't want that happening inside your blood vessels. If that happens inside your blood vessels and a little clot kind of clogs something up or breaks loose and goes to your brain, that's very dangerous. That's a stroke. So there's all sorts of things that can happen when that happens. So yes, the clogging of the arteries is the clogging of the tubing that feeds your whole body, including your heart, and it's the beginning of a whole lot of other problems. Absolutely. Probably not a big contraindication for massage, though. Miss Petrie, you were going to tell us about congestive heart failure.
Yes.
Yeah.
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 Congestive heart failure, sometimes known as just heart failure.
Yes.
Or when your heart muscle doesn't pump as well as it should. Certain conditions, such as narrowed arteries in your heart, coronary artery disease, or high blood pressure, gradually lead your heart to weak to fill and pump efficiently. Like your heart just doesn't pump efficiently. Not all conditions that lead to heart failure can be reversed, but treatments can improve the signs and symptoms of heart failure and help you live longer. Lifestyle changes such as exercising, reducing sodium in diet, managing stress, and losing weight can improve your quality of life. And then it seems as though I wouldn't think that massage would be great for people who are having congestive heart failure, but it says here that they can.
Yeah.
So it says that massage therapy, effective in blood pressure, heart rate, respiration rate, and O2 saturation in patients with congestive heart failure. So it sounds to me like you can massage them.
Yeah.
Which I mean, we all know that those things help, but
Yeah.
we're talking somebody who has heart failure.
Yeah.
So you would think that their blood pressure is going to keep dropping lower,
Yeah.
and
So
that would make worse.
yes, Miss Petrie. So there are degrees of congestive heart failure. By the way, the term is about when the heart stops pumping efficiently, and when the heart stops pumping efficiently, blood essentially backs up down the line. And so, like, blood is not returning well from your legs, and they're filling up with more blood, and it's not pumping through the liver very well, and it's not going through the kidneys very well, and all this kind of stuff is, like, it's a problem because of everything else along your line that gets fed blood, because you need some pressure going through the lines. And congestive heart failure means the pumps aren't working very well for one reason or another, but there are degrees of it. So you might have some minor problems with the beginning stages of congestive heart failure, as opposed to somebody's towards the end stages where it's really, really life-threatening. It is unlikely that massage will make this condition worse. So I always ask people with something that major, like, what does your doctor think about getting massage? But, you know, it's a relative contraindication. Use some common sense. It's not the end of the world. Again, I think I've told you guys about the walk around the block rule. I'm getting some funny faces, so maybe I didn't. So, this is just a TAPSCOT thing. I care about how much your system is compromised before I massage you. Right? So when you have a cut on your finger, that's a local contraindication. That area is really compromised, so I don't work on it. But when you have a fever, your whole system is compromised, right? And massage can tax your system a little bit. It can move stuff around and things like that. So I care about how much your entire system is taxed. I care, can you handle receiving a massage? And in my head, I kind of asked, can you walk around the block? Because massage is not crazy what we're doing to people. We're just rubbing them. And basically, I can't think of anybody who can walk around a block who can't receive a massage. right? But if you can't walk around a block, then you're pretty darn sick. If your congestive heart disease is so bad that you can't walk around a block, now I'm in question of whether you should be getting a massage, right? And so it's just a rule of thumb that I use in my head. There's probably even exceptions to this. But what I'm asking myself is, does this person just seem relatively healthy enough that they could walk around a block? Because if they could, I highly doubt my rubbing is going to make things worse. Does that make sense? They can handle that in general. Yeah? And so when you get these kind of gray areas where you're like, oh, yeah, your heart's not doing so well. Well, it's doing well enough they're able to walk around a block. Or it's doing so badly they're not able to walk around a block, I probably shouldn't massage them without a doctor's release. That's kind of my little test in my head. Right? And it doesn't, you can use your own test, but what you're asking yourself is this person, they might be sick, but are they just a little bit sick to where, yeah, they can still function? You know, are they so darn sick they can't walk around a block and touching them might actually make things worse? That's what I'm asking myself. Does that make sense? Yeah? Maybe? No? Okay. I have almost no visuals, so I'm going to guess that people are nodding back there. Okay. Thank you, Miss Petrie. That's very sweet of you. Okay, so Miss Nguyen. Miss Nguyen, you were going to tell us about coronary artery disease.
Coronary heart in the disease. I mean, in the heart, not enough blood and oxygen and inside heart, and the make forehead in the make forehead in the very hard and very small done, and so you can call. You because in the them has so much in the electron. I mean in the have in the so much in the electron and don't have enough in the OC, and so you can call and them in the same heart attack, right? Heart attack.
Yes.
And when you in the get massage and people have that, you need to call in the 911. You can't massage for them because in the ED, I think in the ED for and the them in the break in the some block out and the making the very dangerous. I think that
Very dangerous.
So
That's good.
yeah, so I think in the have very simple that.
It is very simple. So I didn't talk about this yesterday, but what is your heart, by the way? What kind of tissue is it made out of? Anybody?
Cardiac.
Cardiac. And it's cardiac what? Like what kind of tissue is it?
Muscle.
Thank you. It's cardiac muscle. Yeah, it's a muscle tissue. It only contracts, right? And in order for muscle to keep contracting constantly, I mean, think about when you go to the gym and you're doing curls. Are you able to do that for 25 years? No, you're not even able to do it for 25 minutes. You're lucky if you're able to do this with weight for 25 seconds. So your heart's doing that constantly, and the way it does it is your heart is also pumping blood to itself. So when I said out of the left ventricle, all this blood goes to the rest of the body, part of where this blood goes to is the heart. And the heart has a massive blood supply. Its number one priority is to supply blood to itself so it can keep pumping. And with coronary artery disease, the arteries going to the heart, coronary artery, heart, tubes going to the heart disease are getting plugged. And so not enough blood is getting to the heart muscle. It can't keep pumping if that happens. Pumping efficiency goes down, parts of the muscle die, and then somebody can have a heart attack. And of course, if you have a heart attack, now you're getting no blood to your heart, right?
Yeah.
So it is a very simple concept, and Miss Nguyen's right. It's usually associated with cholesterol intake and cholesterol causing buildup in the arteries around your heart. So it is one of the arguments, by the way. Sorry to make the vegan argument, but it's one of the arguments to eat more fruits and vegetables. So because they don't have cholesterol in them. Okay. So, and yes, if you have a client on the table, don't worry about if they're having a heart attack or not. Don't try to figure that out. You can't. But if you have a client on the table who's having chest pain and a hard time breathing, call 911.
Yeah. So
Call
only
911. That's it.
that you can do. You cannot have everything.
Yeah. Little bit of like, oh, I've got some angina. I think it's something I ate, and they feel fine. I'm not calling 911. But you're starting to have a hard time breathing and you're feeling extreme chest pain. I'm calling 911. Even if you tell me not to, I'm calling 911. There's nothing to lose at this point. Nothing.
Yeah, sometimes the heart is the very important, and you cannot joke with that because sometimes it's very pain, and if you think, oh, no problem, you massage that, but sometimes it's not good for them, and so better if the heart have a problem, I think need to call 911.
I actually understood everything you just said there, Miss Nguyen. Yeah, she's like, the heart's super important. It really is. Like, you can't live long without it. And you might think that it's no big deal, but it's just too important to risk not checking in. And so call 911. That's what 911's for. And that's one of the kind of cool things actually about our country is you can call 911 anywhere and somebody will probably show up in under 5 minutes who knows a whole lot more about this stuff than you do. And seconds count on this stuff. So the good news is it's unlikely somebody's going to have a heart attack on your table because it's a low stress moment.
Yeah.
So
I think when they have in the check and that you cannot moving them.
Oh no! Don't move them. Don't do anything.
Yeah,
Just call 911.
moving, only the call, and
Yeah.
because I think leave them around.
Yeah, call 911. Yes, absolutely. That's just it's a very simple no-brainer. When in doubt, call 911. But what I was going to say is the good news is it's a low stress moment in their life, and it's unlikely that they're going to have a heart attack on the table. I have never met a massage therapist who's had a client have a heart attack on the table. Doesn't mean it doesn't happen, but you know when the most heart attacks happen is Monday morning. So people get up out of bed from the weekend, they start the stress of the workday. Sometimes they're on the toilet.
Yeah.
Because the first thing that they do that's strenuous is go to the bathroom on Monday morning, and that's when they have a heart attack. Anyway, thank you. That was fantastic. Miss Monreal. Miss Monreal, you are going to tell us about DVT, deep vein thrombosis, and I can't wait.
Okay, Kurt, I'm glad you're so excited.
I am.
Okay, so deep vein thrombosis is a blood clot formation inside a vein. And there's inflammation in the vein, and that attracts platelets, which causes the clotting. These clots can travel to the lungs, right?
Yeah.
Right.
Oh, yeah. Sorry. Definitely.
And it is a life-threatening condition. So, as massage therapists, we should postpone if there is a thought that somebody could have that. People who are at risk are people who are obese or who have had recent major surgery, or who have cancer, or who are pregnant, oral contraceptives or hormone replacement, if they are chair-bound or bed-bound, or they have been sitting or driving for many hours, or flying or smoke. Now that was kind of hard, I think, but and you can correct me if I'm wrong, things that we're supposed to look for are like maybe bumps where there's heat or redness. Is that?
Yeah, that's a good one to look for. Absolutely. I agree. Yeah.
Right, but if somebody has been on a flight, you're not going to say, oh, I'm sorry, you can't have a massage.
Oh, yeah. And if somebody said I'm a smoker, I'm not going to say, no, you can't have a massage. I'm going to say, do you have money? Good. You're getting a massage. Absolutely. Yeah.
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 So,
No. We're not there to judge. No. You're absolutely right.
We need to look for leg swelling, heat, redness, pain, and tenderness.
Good. So can can I summarize some of what you said for everybody?
Yes.
Cool. You're 100% correct. So deep vein thrombosis is a blood clot usually in the deep veins of your legs. The fear of this, only question Mr. Tapp's gonna ask, do you have any money? Yeah. I'm like, make it rain. Massage is coming.
And then
Yeah.
I think they said pelvis also. I'm
Yeah.
assuming because they said it, that's correct.
Yeah,
Not in the book, but when I looked up online.
I could see that. I was always taught in the legs, but it makes sense. It's lower extremities, and I'll explain why. The concept is if I sit a lot, or I'm really heavy, or if I'm pregnant and have a baby pushing down on my veins that feed my legs, it's hard for blood to return to the heart. And so sitting a lot does this to you too. It's why it's good to get up and walk around occasionally. Because it gets blood flowing again. Sitting is actually not really good for you. Like, yes, you should sit and rest, but you should not sit for long periods of time. You should get up every so often and walk around. It's really, really much better for you. But anyway, sitting for long periods of time, having lots of weight down in your pelvis from a baby or from your own body, makes it hard for venous return. It's hard for blood to get back up. And so you get pooling in the legs and you can get blood clots in there. And the blood clot in itself isn't a problem. But it's like a little scab, right? That's what a blood clot is. It's like a little scab in your vein there. And if it breaks free, it'll make it through the right atrium and through the right ventricle, and it'll shoot out to one of the lungs. And it clogs up the bronchial tubes in there in your lungs. And that's called a pulmonary embolism. And then the person all of a sudden has a really hard time breathing. And if you think somebody has a risk of deep vein thrombosis and they seem to be having a hard time breathing, that's a good time to call 911. So we look for it especially in women that are pregnant because they temporarily can have this problem. And so if I had a pregnant woman who was all of a sudden having a hard time breathing, I don't mean she walked in and said, I'm having a hard time breathing because I have a baby in me. All of a sudden her breathing got much worse for no reason. I would worry about deep vein thrombosis with her. Ms. Monreal's right. I can't just guess with everybody that they're having deep vein thrombosis. But again, if somebody's having a really hard time breathing, that's a 911 regardless of what it is. The other thing I will say is she's absolutely right about swelling in the legs, but look for this especially. Lots of people get swelling in the legs. Lots of people get swelling in the hands. Look for uneven swellingness. Uneven swellingness is what freaks me out. I don't care if both your hands are big and swollen. I care if one's swollen. I care if one leg is big and the other one's not as big. That tells me there's something really funky going on in just one side, and that's the fear. Look for unevenness. Does that make sense? On everything, everybody. If you don't see evenness, that's a concern. So heat, pain, and swelling in one leg, that's a real sign of deep vein thrombosis. That's a good time to say, no, we're not massaging this leg. The fear is if you massage it, you will break loose the blood clot and it'll go to their lungs. And so and there's a test that massage therapists can do for it that we do on pregnant clients called the Homan's test, where we actually straighten your leg out. Do I have my little guy here? No, but I'll show you later. Straighten your leg out and we dorsiflex your foot while we're squeezing your calf. And if you get a little pain down there, it suggests you might have deep vein thrombosis. And if you go to a doctor, and if you were pregnant and you really had a lot of pain in one leg and not the other, I would stop the massage. I wouldn't even start it. That's the first thing I do. But I'd send you to the doctor and they do an ultrasound, and the ultrasound will show the blood clot. They know like that. They're like, oh yeah, deep vein thrombosis. They put you on these clot breakup things and blood thinners and they get rid of it. Yeah. So DVT, if you know somebody has DVT, it is an absolute contraindication. I know it's locally found in one leg, but it's an absolute contraindication. People can die from it. So nobody's going to walk in and be like, I have DVT, but if they did, do not massage them. And it is something. Go ahead.
I'm sorry. Would that happen anywhere else besides the legs? I mean, is that a thing to have clots be somewhere else?
Yes, clots can be anywhere, but, but because of the way your blood pressure works and the way blood pools and the way you get pinched off your arteries and veins, the lower body is the place that is, don't quote me on the amount, but it's 95% of the time lower body. You just don't hear about a lot of blood clots in the arm. That gravity takes care of a lot of this. It's the lower body where these blood clots seem to form and break free. So deep vein thrombosis is always checked for in the lower body. I've never heard of a case of it in the upper body ever. That doesn't mean it doesn't happen, Miss Monreal, but I just never ever heard of it. So it's very unusual. And at that point, you can't check for everything, right? But if I had somebody who was pregnant, really overweight, and one leg swollen and hot and painful, I'm like, no, there's something really wrong here, right? If I actually had a client who was skinny, a runner, and in great shape, and one leg's really swollen and hot, I'm gonna be like, there's something wrong here. That's just weird, right? If both your legs are swollen, I'm like, oh, you came off a plane, you have been sitting a long time, both your legs are swollen, that's normal, that's fine. I'm looking for unevenness.
Okay, but if you had a runner and then you saw that, what would you think then? As far as like, let's just say that there was heat and redness, what would you think?
And swelling in one leg only?
Mm-hmm.
I would think, this is the level of my knowledge too, this is really honest. I would think, my, there's something wrong in that leg. I don't know what it is. This person should go see somebody who does know.
Okay.
Yeah, I mean, I might for a second think, oh, it could be deep vein thrombosis, but I used to do that when I first got out of massage school. I was like, oh, yes, your spine is this way, and this is what's going on, and I know just how to fix it. But in about a year or two, I realized I didn't know diddly squat. And so I just would start assuming several things and work on them. Because even doctors, I know they try to act like they've got it all figured out, but if they're really honest with you, they're shooting in the dark most of the time too. Nice thing about massage, you don't hurt anybody. But anyway, so I would just say there's something funky going on, right? That's what I'm looking for things where I'm like, that's weird. Swelling's not that weird. You're retaining some water. You had some salt. You drank a lot of water, whatever. But one thing swollen, that's weird. Always worried about that. I, at the bare minimum, would not massage that one swollen thing. At the bare minimum. And let me give you an example where this is not dangerous, but you still wouldn't massage that one swollen thing. Somebody hurts their knee. That whole knee area swells up. You wouldn't massage that either. You'd definitely be like, there's something wrong with that knee and the other one's okay. But in that case, the person would be like, oh yeah, I bumped my knee. And you'd be like, oh, okay, well, we can do the rest of the massage. We're just that's a local contraindication.
Now, what about people who have an issue, and I know we're getting off the subject really quick.
No, we're not.
With meniscus, and then their leg swells occasionally.
Yeah.
Would you still do some type of light work on that?
So you're saying, by the way, she's talking about the knee and the pad inside the knee. We'll get to this later, but and it gets torn and all sorts of problems happen with people's knees. So and the person knows it's the meniscus, and they're telling me it's the meniscus, and they're telling me the story.
Yeah, so I have a friend, and she doesn't want to go get it fixed. She doesn't want the surgery, probably just because she's just scared. But every so often, her knee swells up a lot. And she's like, hey, do you think you could rub it for a little bit? And I just do light rubbing, but my other friend's like, oh, you shouldn't be working on that. And I'm just like, okay, what's the big deal? But anyway.
Now remember, I'm old school, everybody. Textbook, you'd say don't touch it, but Miss Monreal, I'd do the same thing you did. I'd test the corner of the carpet, meaning this is a regular client, obviously, or a friend of yours, regular friend of yours. I'd massage it once lightly, and to actually try to get some of the swelling down. I'd be massaging it back up to the heart, and I'd be like, how'd you feel the next day? And if they're like, oh, I actually felt better, then I would do it every time. You're absolutely right. It's a known condition. It's not going to kill them, right? You're probably not going to make it any worse, even if you massaged it hard, except you're going to hurt them. But I meant it's inside the knee. Yeah, I personally wouldn't hesitate. But that's what, we know it's the meniscus. I trust this person, that kind of stuff. But yeah, I think I've done that before, what you're talking about. I think I've been in the exact same situation you have been. Wouldn't worry me at all.
Okay.
Yeah, I'm worried about uneven, unknown swelling. Uneven, unknown swelling. That's uneven, known swelling. That's a joint problem. Inside the joint. Yeah, go for it. Massage them. Yeah. And that was a very good question. Because you're right, those are super gray areas. Okay, DVT, by the way, deep vein thrombosis. You'll hear people talk about it, DVT. You hear about it in pregnancy massage all the time. Okay. Hypertension and hypotension. Mr. Kandaris is going to tell us about those, hopefully in very simple language.
So basically, hypertension is just high blood pressure, and hypotension is low blood pressure.
That's exactly.
Basically, what I would like, low blood pressure can just cause like dizziness or fainting, and high blood pressure can lead to strokes. It's not really a contraindication. You can massage somebody with high blood pressure, and a lot of the similar things. There's a lot of things similar to what Ms. Petrie said about like with her. What was the name of it again?
I don't remember. With congestive heart failure?
Yeah, because she was talking about high blood pressure being involved in that, and the same low sodium diet, exercise, quit smoking, stuff like that.
Yeah.
And I know with high blood pressure, they always say like, don't get mad, you'll raise your blood pressure. So trying to stay calm, I guess, would help with people who have high blood pressure.
Yeah. It is, stress related. Drinking, smoking, and stress don't seem to help high blood pressure at all. They seem to create it quite often. Certain types of heart disease, you're absolutely right, can cause high blood pressure. Can be that's why high blood pressure is, they worry about it because it can be a sign of those other problems. And you're right, not a contraindication, despite what anybody tells you. I don't know how many massage therapists I've been to who go, do you have high blood pressure? And I'm sitting there thinking, sometimes I just tell them yes, just to see what they'll do. Because it's not a contraindication. I don't know why they're asking me. The massage doesn't hurt me for high blood pressure. My blood pressure is going to go down on the table. And they're not asking. If I was a personal trainer, I care about high blood pressure. I'm about to have somebody run around. And they already have high blood pressure. It's going to raise when they exercise. And I don't like asking people questions that waste time. Because then we have a long discussion, and is it under control, under medication? And those are good questions for other professions, but as a massage therapist, I don't care. I don't care. I care more about low blood pressure, and Miss Yanas already knows why I care more about low blood pressure, because she correctly identified it, right? And that's because they can get up off the table, their blood pressure is even lower now, and they faint. And they hit their head on the floor. And it wasn't the low blood pressure that killed them, it was the hitting the floor. So blood pressure is essentially not an issue for massage therapists, except as a relative contraindication when they have low blood pressure. And how do we tell the difference between hyper and hypo? Hyper, like hyperactive. Oh my God, I'm hyperactive. I've got hypertension. It's high. Hyper, high blood pressure. Don't care, but you've got it. Hypo, like hypodermic needle, means below the skin. Hypo, low. Hypo, low blood pressure. I do care. I'm still going to give you a massage, but I'm just going to be a little bit more careful when you get up and tell you to take your time and kind of keep an eye on you a little bit, right? And remember, if somebody faints, you're grabbing anything that goes by you. Anything. You're not trying to catch them, you're trying to slow their fall. And I'm not kidding. Your hair goes by me, I'm grabbing it as it goes by. Especially your hair, because it's your head that I don't want to hit the ground. It's still going to hit, but we're going to slow it down as you go by me. I'm not going to hesitate. Grab your robe, your nose, anything that goes by me, okay? Don't sit there, because a lot of people go, oh, I wonder if they're... It's too late. Or, oh gosh, I shouldn't touch them. No, grab anything when they're going by. Okay. Cool. Thank you, sir. Hyper and hypo blood pressure. Cool. Miss Bilotic, I love this one. Myocardial infarction.
Okay, so myocardial infarction is a medical term that means a heart attack.
Yeah.
Which is a sudden disruption of blood flow to the heart muscle, or is basically caused by a broken blood vessel inside the body. Tissue becomes damaged after that and cannot regenerate, which then it becomes a permanent scar. It's estimated about 3 million people in the United States have experienced myocardial infarction a year. Heart attacks are an event that needs immediate medical attention. If your client has had a heart attack, ask why and how recovery is proceeding. If someone has a heart attack while in your presence, immediately call 911. If your client is further in with recovery, normal massage pressure is allowed. Make sure to communicate with your client about pressure and tolerance. Communication is very important. And then after experiencing the scary event that is a myocardial infarction, a massage can benefit your client by decreasing any anxiety they might have.
Yeah. Yeah. I was just trying to think if I wanted to add anything, but myocardial infarction is a heart attack, and your client will probably be like, I have a heart attack. Can you work on them or not? Ms. Bilotic was right what she told us. Can you work on them or not if they've had a heart attack? If I come to you and say, I've had a heart attack, can you work on me? Anybody?
How soon?
Yes, you can work on them.
Okay. Yeah, essentially the answer is yes. Again, walk around the block. If I come in like this and I'm like, I'm recovering from a heart attack. I don't care if you had it last year or yesterday. I'm recovering from, can I walk around the block? No. I want a doctor's release for this person. They don't look so good. If I come in, I'm like, I had a heart attack, yeah, last week actually, but they say I'm okay to go around and stuff. And I'm like, oh, you just walked in from the parking lot and you're kind of breathing normal and you look a little tired, but you're fine. I'm going to give you a massage. Can they walk around the block? Okay? Massage doesn't cause heart attacks, so that's the good news. You're probably okay no matter what. Guess what I do worry? I want to check and see if they've had open heart surgery and things like that, because I want to be very careful about pushing on their chest because they might have a scar there, things like that. But that's it. Good job. Thank you. Heart attacks. Myocardial infarction. All right, Miss Harper. I'm sorry, I know you have a headache, but can you quickly tell us about peripheral arterial disease?
Yes, sir. Peripheral artery disease, it is a condition in which the arteries are narrowed or it can carry as much blood to the other parts of your body like your arms and legs. And if you don't get treatment for this, you can have more likely to have heart attack or stroke, or sometimes limbs. And also pain or discomfort in the legs is the common symptoms of this disease. So people who usually smoke or have diabetes have the greatest risk of developing this kind of condition. Massage provides help this kind of condition to help ease pain and discomfort. But we need to be safe. We need to be careful because to avoid loosening of blood clot, which can have a devastating consequences. But before you massage the client who have PAD, you need to have the permission from their doctor.
Yeah, I agree.
Because sometimes it depends on the client's management of the disease. They can have like DVT,
Deep vein thrombosis, yeah.
So you need to have the permission from the doctor because sometimes they can give you like a suggestion on how you can massage them, and sometimes short intervals of massage can help.
Yeah, thank you. So it's unusual for you to get somebody as a client come to you and say, I've got peripheral arterial disease. But by the way, I hope, just by hearing this, you guys already had an idea what it meant. We know what the peripheral nervous system is, right? It's the stuff going out to the limbs, the arms and legs, and stuff like that. So peripheral arterial are your arteries that go out to your arms and legs, and they have a disease. And I hope you've noticed, by the way, that everything we've talked about so far really has to do with clogged tubing. Right? Your arteries or your veins are getting clogged. There's a blood clot in there. They're narrowing. Stuff's not happening, so blood's not getting to the heart. Blood's not getting out to the arms. Blood's not getting somewhere. The blood's not getting back up the legs. But this has to do with clogged tubing, almost all of this. Almost all of it. So this is clogged tubing going out to your extremities. If somebody were to tell you they had this, yes, the fear is that you could break loose a clot, and so you want a doctor's release. I've never had a client come to me and tell me that they have peripheral arterial disease, but it's one of the things I'd be like, does your doctor want you to get massaged? Like, if they said yes, they had a release, I would do it. But that's the fear, is you'll break loose this clot. They're kind of telling you they've got deep vein thrombosis in a way. You know, that they've got this, they're not telling you the thrombosis yet, which is the actual clot, but they're telling you they've got a clogging of these arteries, and so it could be a problem. Yeah, well said. So it is an absolute contraindication without a doctor's release. Just to sum that up. Thank you. Miss Hanson, phlebitis. Phlebitis. And what is do you know what the end itis means on that word?
Infection?
Inflammation.
Inflammation?
Yeah, and I'm sorry, just let me interrupt you for 1 second, everybody. You're going to see itis on the end of all sorts of stuff. People are going to come in and be like, I've got tendinitis, ligamentitis, bursitis. It always means inflammation. Yeah. So anyway, phlebitis, please, go ahead.
Phlebitis is inflammation of the veins. It generally affects legs, arms, hands, and feet, but it can also affect cranial veins. It can be caused with or without a blood clot. If it's caused by a blood clot, it's called thrombitis. Thrombitis. It can be what?
You said it right, thrombitis.
Oh.
Thrombitis.
It can be superficial near the surface of your skin, or it can be deep within the muscle. When a vein is close to the surface of the skin, is affected. You might see red hard cord just underneath the surface of your skin. That's tender to touch. When a deep vein is affected, it may become swollen, tender, and painful. You probably should see a doctor if you have any of these symptoms to rule out blood clots. Common causes is an injury to the vein. It could be an inherited blood clotting disorder or being immobile for long periods of time. If you know that you have this and it's not a blood clot, you can massage it. You don't massage the affected area, but you can massage just prop up the affected area on a pillow or something.
So what kind of contraindication is that? What do you call that?
Is it local?
Yes, it's local contraindication. You don't massage the area. And you, by the way, I'm sorry to interrupt again, but everybody, this is assuming somebody says, I've got phlebitis, it's inflammation of the vein, my doctor said I can get massage, it's fine, but it's just a local contraindication because it's so irritable, that area. If they don't know, Ms. Hanson was exactly right. It could be DVT, right? Because it's the same symptoms, and they should go get it checked out. But let's say they do know. They're like, yeah, it's phlebitis, it runs in the family. You just don't massage that area, these inflamed veins, which you shouldn't be massaging anyway. Please, anything else?
It just said to prop it above your heart to make sure that whatever is affected is above the heart.
Cool. Why above the heart?
I guess doesn't that make the blood flow towards your heart?
Yeah, reduces pressure in the area and makes the blood flow back to the heart so it doesn't pool. Yep. Yeah, for the longest time there, I don't know if they still do it, but when people are having heart attacks, they lift their legs up, by the way, to push blood back into the heart, give it more heart to work with. But anyway, yes. Cool. Thank you. Thank you. Ms. Felix Osuna, Raynaud's syndrome.
Hi, the Raynaud disease is a condition in which some areas of the body feels numb or cold in certain circumstances, like cold temperatures or stress.
Yeah.
It happens on the fingers, the tips of it, of your nose, your cheeks, and it happens on the tongue as well. They don't know what causes this, so I'm not sure what it is or why. It shows in changes in the color of the skin, and if it's like a whitish, it means that the blood is cut off, the blood flow. So when they change to like purple or a little darker color, it means that there's low oxygen supply, and when it turns to pink, it means that the blood is finally circulating again.
Yeah.
It can be massaged only if they experiencing an attack rate, like when you're massaging them. So when it happens, you can get cold towels and just apply it on the area that is affected, or you can use some cold water as well.
Cold water?
Yeah, cold, or no, warm water.
Okay, that's what I thought.
It is a local education.
Cool. So everybody, this is essentially a non-threatening disease from almost everybody. They think, they don't know what causes it, but they know what causes it, but they don't know what causes the cause. There seems to be spasms in the veins and arteries that cause them to close down when they shouldn't, and so you're not getting enough blood to an area. And a lot of people get like blue underneath their fingernails and stuff. They're not getting enough oxygen down to their fingers and stuff. And it gets really cold, and you can massage it. In fact, sometimes massage really helps because you're warming it back up. I would argue you can even massage it when there's an attack going on. And they'll know they have it. They'll be like, I've got Raynaud's disease or syndrome, and it's again, the blood vessels are spasming, and remember they're made of smooth muscle. They can expand or contract. Well, they're contracting when they shouldn't, and you're not getting enough blood down to that area, and so their hands get cold. It's most common in the hands. They get cold, things like that. You guys experience this in the morning when you wake up sometimes. You know how you feel like you don't have any strength in your hand, and it's kind of cold? That's because your body has shut down a lot of blood to them because you're not using them at night. That's kind of what it's like, but yours warm up once you get going. Cool? Well done, thank you. Miss Cooper, this one's important because lots of people have it, no pressure, but what are varicose veins?
Hello.
Hello.
So, varicose veins are, they're swollen, like twisty veins under your skin, and they're caused by weakened, like your veins are weakened, and so your blood is flowing backwards and ends up pooling in your veins. Mm-hmm. And people, it's usually not painful, but it can be very painful for people. Just like it can swell up and hurt them a lot and make it hard to kind of, like, you can walk, but I don't think you'd really want to. You'd be like, oh, my veins hurt so bad. You know what I mean? Kind of. Mm-hmm. And then let me think if there's anything else. Well, it can also be caused by blood pressure. Like if your blood pressure is too high, it makes your veins pop out. I was confused about massaging it because I read multiple things.
Everybody is. There's a lot of controversy on it. Okay, so everybody, varicose veins are not like when you see a bodybuilder and their veins are popping out. Their veins are popping out because they don't have much of a fat layer and their muscles pushing their vein towards the surface. Varicose veins are actually the vein walls are weakening, and Ms. Cooper's exactly right. They kind of balloon out a little bit, and they don't look very pretty. They look like they're on the surface.
Yeah, it makes people sad.
They're usually in the lower leg because that's where pooling most easily happens, and they can be quite painful. They are most definitely a local contraindication. You don't massage them, especially if they're painful. If they're really mild and it feels good to them, there's a lot of controversy, and a lot of people would say massage them. I might massage them, but in general, they're a local contraindication. You just don't massage the varicose veins. That's the simple answer. I can't give you a better answer than that because it's too controversial. Some people say, and I'm even kind of one of those people who's like, if they're really mild and it feels good to the client, it might be okay, but you run risks of rupturing the vein and things like that. Definitely don't ever rub them if they're painful. And the textbook answer that I think would not be a bad idea to follow is just don't rub varicose veins. They look like you shouldn't rub them. They look raised and tender and thin and like they might break easily, and so don't rub them. And it might be painful to walk. Ms. Cooper might be right about that, but walking is the very thing they need to do.
I have them behind one of my knees.
Now, do you have varicose veins or do you have spider veins, Miss Petrie?
No, varicose.
Really?
Yeah.
Huh. Are they painful?
They can be. Sometimes they can be really tender.
Yeah.
Some days I don't have an issue with them at all, except for I don't really enjoy wearing shorts.
Sure.
Because people notice them.
Sure.
Sometimes people point them out to me and ask me what that is.
Oh.
Yeah, so that seems rude.
Yeah.
It's not the prettiest, but I've had them since I was young.
Yeah.
I used to be a runner, a long distance runner when I was in high school and middle school. So I started getting them.
Interesting.
Yeah.
So that is an unusual way to get them. But Miss Petrie makes a much more important point, which is we're going to see all sorts of stuff on clients, and be very careful about asking, what is that? Because that sounds really, people are already really have issues about their bodies, and the last thing they need to hear is, what is that? I ask things, oh, go ahead.
Which is really nice. So maybe they're starting to go down.
Yeah.
I don't really anybody really noticing them at this
Good.
point.
Yeah.
It could be that they're starting to go down, but they still hurt at times.
Yeah.
For sure. Like they feel tender and sometimes not even just tender, they can start to feel hard.
Yeah.
And feel, I don't know how to describe the pain. It's not like agony.
No, achy?
Yeah, it's just uncomfortable.
Yeah. So, like Miss Petrie's a great case. She's a local contraindication. We wouldn't rub behind her knee, right? I'm not going to rub really deeply behind the knee anyway, so definitely wouldn't do it if I saw a raised vein there. If I was massaging her for the first time, I might say, does this hurt? Because what I want to find out is, I don't want to say, what's this? Because that sounds like, what's this weird thing? But I want to say, does it hurt? Because I want to make sure she's aware she has that. It is your job, by the way. They don't tell you this in textbooks. My opinion is it's your moral obligation to make sure people know about stuff on their bodies, but it's also your moral obligation to do it in a nice way. So most people don't get to see their backs. And even most people's spouses aren't touching them the way you are, right? You're actually scanning their spouse might hug them, whatever, but their spouse is not scanning every section of their body. Think about it. You're actually touching people more thoroughly, more surface area than anybody in their entire life will, period. You are more likely to find things that nobody has found. It is weird, but it's also kind of cool. So you are more likely to find a lump that their spouse of 25 years has never found, because their spouse isn't scanning that stuff, right? Their spouse isn't rubbing the back of their leg, right? So I always say, hey, does this hurt here? And they're like, oh, what? Oh, you got a little bump back here. It's probably nothing, but if you didn't know it was there, you should probably get it checked out. Oh, does this hurt, Miss Petrie, behind your knee? Yeah, it does a little bit. What is it? Well, it looks like you've got a raised vein, little kind of thing. You might want to get checked out. You know, I want to make sure she knows it's there, but I also don't want to make her feel weird about it, because people have bumps all over their body. And by the way, usually they are nothing. But I want to also make sure I tell them. So when Miss Petrie and I worked at the Princess, there were several times massage therapists told a client about a bump on their back, and clients wrote us back and said, I went and got it checked out and it was cancer. Thanks for saving my life. You are going to give somebody a more thorough integumentary exam than any doctor will ever give them in their entire life. So you will physically catch cancers that other people would never caught, and save lives. So make sure you do bring it up. Just bring it up really nicely. And what I usually do care, does it hurt? Yeah, go ahead, Ms. Cooper.
Well, I just said that's crazy.
It is crazy. But so go ahead and bring it up nicely. And I do care if it hurts, because a lot of stuff is like, some people have what are called lipomas, which are fatty little cysts. This has nothing to do with your weight. They got fatty little cysts. They don't even really know they have it. When you're rubbing them, you can kind of feel them around them. And so I just want to know if they're aware of them and if they hurt. in and of themselves are not dangerous at all. And some people have them all over the place. So we're always just trying to make sure our clients are aware, is it all cool? And so I've brought that up to clients before and they've been like, oh yeah, they're lipomas. I've got them everywhere. Okay, cool. We're going to keep, do they hurt? Nope. Then we're going to keep massaging normal. No big deal. Cool. Thank you. Varicose veins.
They can look like buttons. I have one.
Oh, the lipoma?
Yeah, they
Yeah.
can actually like a button that you can push.
Yep. And if you can't, sometimes you can't see them, but they feel like a button underneath the skin. Yeah.
Right.
They feel like, yeah. They're called lipomas.
Mine pops out.
Most people have them. My girlfriend's got one somewhere in the back of her leg somewhere. And I've worked on clients that have 50 of them. And you couldn't see them, but you could feel them all. Yeah. Anyway, perfectly normal. Just want to make sure they're aware of it. You'd feel terrible if you found something on somebody's back and you thought, well, I don't want to say anything, and later it's some problem. Okay, so thank you, Ms. Cooper. Varicose veins, local contraindication. Don't rub raised things that look really inflamed and painful. Good rule of thumb. Okay, Miss Hunter, luckily, you may not be able to hear me well, but we've been able to hear you really well, so that's good news. And fantastic is right. And I gave you a very hard task. I hope it was for the right reasons. I'm just curious what you want to tell us about today. No pressure.
No pressure. I came up with something. However, like, I don't know, maybe after you've given me free reign here, you're probably never going to give it again.
Oh, I doubt that.
No, so I went on Google and I searched some really cool facts and such about heart and blood, and I got rid of the ones that were boring, and then I kept the ones that I liked, I thought you guys would enjoy.
Yeah.
And then I have a small presentation regarding implantations. I know, right? So stop it. Implantations in regards to cardiovascular pathologies. I felt like it can't all just be fun.
Right.
So.
Yeah. Okay.
So I was reading through the book and I didn't know if you would go over this, so that's why I wanted to make sure I did, regarding like defibrillators, arterial stents, and like pacemakers. Were you gonna go over that?
No, and I should have. So this is really fortuitous. So thank you for doing my job.
Awesome.
This is awesome, because I should go over that and it wasn't in my presentation at all. And I would have never mentioned it. Thank you.
Awesome sauce. I'm glad I'm doing something. Okay. All right. Arterial stents. They are small tubes inserted inside damaged arteries. They are usually used in branches of the aorta, coronary, or carotid arteries, but they can also be used in brain vessels. It's a local contraindication for the most part. I mean, if you see it, but for the right, but it can. If people have these, they could also be on blood thinners. So then you would, adjust your massage accordingly to that, because if they're on blood thinners, they could possibly get bruised more easy. But it's not like you can't massage them.
Can I describe a stent?
No, go ahead.
Is it okay to describe a stent really quick? Do you mind?
Please do. Yeah.
So if you have an artery that they think is kind of collapsing a little bit, they put a microscopic spring in there to kind of boost it up. So it's like they're reinforcing the tunnel of the artery. And the reason they put you on blood thinners is blood goes floating by that spring and they don't want the blood to kind of collect on the spring and create a clot there. But anyway, it's like a tiny little wire spring holding the blood vessel open more. Thank you. That's all.
Cool. Defibrillators. A defibrillator is another device that controls, so there's pacemaker, but then there's also, but I haven't done pacemaker yet. So defibrillator is a device that controls the heartbeat, but unlike a pacemaker, it is designed to intervene only when needed. So people who have implanted defibrillators typically have tissue damage from a history of heart attacks. A person with an implanted, I don't like saying this word, but yeah, with this implant, needs to keep cell phones a minimum of 6 inches away from the device, and avoid using headphones because of the magnets. And so massage therapists who use magnets in their therapy should likewise avoid this with these patients.
Yeah. So really quick, everybody, what she's talking about is this is for somebody who has frequent heart attacks for lots of reasons, and sometimes small ones, which causes lots of damage to the heart. They implant a device that's just like those paddles that you see them use, where right? But it doesn't do it really big. And it sends a little shock if it senses that they're having a heart attack before they kind of go into the attack. And the shock is meant to get their beating back on rhythm, right? So but it's like a little mini paddle machine inside their body. Yeah, thank you.
Thank you for the explanations, because even I don't really know what they are. That's really good. Then the next one is the Vena Cava filter. Have you heard of that one?
No!
Yes. Okay, so a Vena Cava filter is a small wire device shaped like an octopus. It is inserted via a leg vein into the vena cava in order to trap clots that may ascend from the lower extremities. Yeah. I don't know if this is new or what. Trapped clots can then be melted with natural or supplemented chemicals before they do any damage.
So I've got to rephrase what you just said.
Blown.
It is kind of mind-blowing because we talked about deep vein thrombosis. We talked about all this stuff, and I said, the clots don't matter, everybody. The clots matter when they float around and get in your lung or your brain, right? That's a stroke. This is a pulmonary embolism, and those kill you. But the clotting in itself is no big deal. So they put a screen in, probably into the inferior vena cava, I'm assuming, to catch all that stuff coming back before it gets into the aorta and it gets caught in the screen, right? Just like you have a screen over like stuff in your plumbing, right? And then they can melt it later. There's all sorts of drugs you can take that'll break up clots. So, but you get it before it gets into the right atrium and goes back to the right ventricle into the lungs and stuff like that, and you stop it there. Never heard about that. Totally worth it, Miss Hunter. Thank you.
Awesome. And yes, you can still massage face people. And then pacemakers, which I felt like a pacemaker is probably the main one we'll probably all see. A pacemaker is a small device that controls the heartbeat when the body's natural system to fulfill that function has been damaged. Yeah, you got it? Okay. A pulse generator is housed just under the skin of the chest, and leads are implanted in the heart. Pacemakers that have been in place for more than a few months pose no specific cautions for massage, as long as the client is comfortable at table. Practitioners who use magnets as part of the therapy should probably not do that, though. It's not a huge deal, I think, because even like in the airport, like I don't know, sometimes they still can go through, but I think a lot of times they don't go through that magnet. I don't know what that is. What's at the airport?
You mean the metal detector or the full body scan?
But yeah, that, yeah. But I don't know. I just wouldn't use I don't think I will use magnets. I don't know. I know there's health benefits with magnets, possibly, but I don't know. So that's that. And you can still massage someone with a pacemaker.
Yes, but it is a local contraindication. You don't massage the pacemaker.
Right. Yeah. And a funny fact about the world's first pacemaker. The world's first pacemaker was actually plugged into a wall. Like while it was in the person. Like that's how they had it set up. So I thought that was interesting.
That's super interesting.
I also have a few other. Go ahead.
Yep, before you do, I want you to keep going. I just want to let everybody know, when you see this on somebody, it looks like a perfect raised circle on their body. Like, you'll know it. It looks like somebody inserted a stack of quarters under their skin, essentially. You'll know it. It's totally fine. Don't worry about it all. Just don't massage right around it. I mean, that's all. But there, you can massage them. That pacemaker, by the way, is sending little electrical signals just like your nervous system does, just like I told you, to make sure their heart keeps beating at a certain pace or doesn't go too high or too low. That's all. Sorry, keep going, Miss Hunter. That's fantastic.
You're fine. I found other little facts. A fun fact, the only place where blood cannot be found in the human body, do you know where that is? Anybody?
I don't know where that is.
I know, it's a living thing too. It's not, because like hair and nails don't have blood, but I'm talking about a living thing in your body that does not have blood. Does not use blood. Or, have blood. What was that?
The brain?
I could guess. I mean, I hope your brain doesn't.
Your brain?
Yeah, our brain does utilize blood. I hope. Maybe.
But
I hope it does.
but it's got some filters to keep out the blood and let just the nutrients in, I thought.
Yeah.
Anyway, keep going. I don't know. What is it?
It's not the gallbladder, thanks, Mandy. It's actually your eyes. So your eyes actually. Well, okay, so it says the only place where blood cannot be found in the human body is the eye, because as you can imagine, blood vessels would obstruct your vision. So instead, the nourishment comes from tears. So I was like, oh, I didn't even think about that, but we don't have like blood literally, like, I mean, sometimes people have bloodshot eyes, I guess,
Sure.
But like, that's not a normal thing.
Yeah. And maybe they mean the eyeball has blood, but not the center part or the pupil or whatever. Interesting.
Right. It says what is it called? The cornea.
Cornea.
Yeah, that
cornea.
part of the eye.
Yeah, that's the very small part. And that's true. You never see that bloodshot. So the next time I'm crying, I can just be like, I'm just feeding my eyes.
Right. Another thing is that we've never heard of heart cancer. Has anyone heard of heart cancer? No? I have never heard of it. It's not really a thing because what I found in my studies was that heart cells don't divide. So I guess all other cells do, like Mr. Tapscatter's been, but the heart, I guess, does not. So instead of heart cancer, it's like other heart problems. Right. So
because
I didn't think about that.
I've never thought about that either. That is amazing too. Cancer is a cell dividing out of control. It's growing too fast. It's just gotten carried away. The cell in itself isn't bad, but it's just going out of control. So cancer is really out of control growth. And if heart cells don't divide, they can't grow out of control. Yeah.
Yeah.
Wow.
I have a lot of facts. I won't go through them all. In fact, I was like, maybe I can like post them in the chat while you're doing your lecture.
Do whatever you want.
But I just wanted to say the ones that were very interesting. The ones that I really like. I mean, all of the ones I wrote down are the ones I like, but I just want to say one more thing. Before the stethoscope was invented, like what did doctors use? Like for like the stethoscope is a tool used to hear your heartbeat. So yeah, back in the day, what did they use? Mr. Tapscott, were you?
Was I there back in the day? Is that the question?
Yeah. No, I saw you doing hand movements.
Oh.
Sorry.
I don't know.
What were you saying?
Was it kind of like a funnel, like a cone of some sort?
Probably, to be honest. Well, actually, what I found was they literally just put their head on the chest. And so a French physician, he in 1781 to 1826, he invented the stethoscope when he felt it was inappropriate to place his ear on a large buxom female patient's chest. So then he's like, I gotta figure something else out because this is so inappropriate. So
That's awesome.
yeah. So that's it. Just a few facts.
That was fantastic. So,
That's hilarious.
yes, it is. So, Miss Hunter, I have one complaint about your presentation. And,
Oh no.
well, yeah, and that is you're making me look bad, and that we cannot have that.
Oh,
Right.
how was that?
Because that was way too good. Because you taught me like 6 things I didn't know, and you were entertaining, and you're gonna put me out of a job. Thank you.
Oh
That
my
was
God.
fantastic, and you covered stuff wasn't gonna cover. I wasn't even gonna cover pacemakers. How could I not cover pacemakers? Everybody in this room will get somebody with a pacemaker, and I wasn't even gonna mention it. Oh my gosh, you saved the
Well,
program
I looked
today.
at the book hardly had anything on pacemakers, so I was like really shocked because I was like, I'm kind of nervous about having a client with a pacemaker. So I was like,
Is that a pacemaker joke? You were really shocked?
shocked about the book not saying anything. Yeah, a little bit.
Okay. Awesome. Any questions, anybody? Very good job, Miss Hunter. Really, really entertaining, really enlightening, and made us think. And I don't know, I just liked it. It was great. It's awesome.
Cool. I could post some more facts in the chat.
Feel free to do whatever you want. If anybody ever, by the way, I don't want you to feel like I'm playing favorites. I mean, we all know Miss Hunter's my favorite, but no, I don't want to play favorites. This all came up because of a conversation her and I had. If you ever feel like, gosh, I would like to not be assigned something, sometimes I like to do my own thing, send me an email and let me know that, and I'll keep that in the back of my mind. And I'm not expecting you to guess what I wasn't going to teach that day. I mean, Miss Hunter did a great job. She also got lucky, I think, with some stuff, which in a good way. But anyway, I just don't want you to feel like you can't have the same treatment. So anyway, let me know if you need to. Send me an email. I'll remember it for the future. Okay, everybody, really good job. Super enlightening. And let's really quickly review the heart stuff. So yesterday we did an overview of how the heart works. We did it again in lab. I honestly think out of this entire chapter, that's the most important stuff. Today, you guys all did a great job of talking about diseases of the heart. I think we found out that almost all of those are really problems with the arteries and veins not getting enough blood flow through them. And when they close down, then other problems happen, right? Blood clots get formed, blood pools in the leg, blood clots go to the brain, they go to the lungs, the heart doesn't get enough blood, it stops functioning. But it really oftentimes is about tubing issues of one kind or another. I hope we learned too that what we look for today is if there are raised veins, they're painful, that's probably just a local contraindication. If there's uneven swelling in an area and the person doesn't know why, that's probably an absolute contraindication. They need to figure out why before you work on them. That could be a sign of all sorts of stuff. Cool. Okay. I'm going to share. Do we need a 5-minute break before we go into anything? I feel like we do. I'm seeing some people like, yeah. Okay. We got some definite nods. All right, everybody. Let's take 10, actually. That was so amazing. Let's take a 10-minute break. What I want to do is quickly go through a slide presentation on this chapter on the cardiovascular system before you take your final test on it. I don't actually want to spend a lot of time on it because I honestly feel like you have the most important information you could have about the cardiovascular system based on the fact that you understand that the heart is a 4-chambered pump and why it has 4 chambers and where they go and how it picks up oxygen and how it takes the rest of the body and picks stuff back up and takes it back to the heart, and how most heart issues are actually problems with clogged arteries and veins, and that can happen all over the body. And I think you've got a real grasp, that kind of 5-year-old knowledge, and I'm not diminishing what we're doing. I'm saying that real understanding of something. And the rest of what we're going to be going over is names for things, right? And if you forget that the valve between the left atrium and the left ventricle is called the mitral valve, it's not going to affect your massage at all. It's not going to affect anything. It doesn't help you at all. I want you to be aware it's there, so if you ever hear it again, you're aware of it. but it's not going to change anybody's life. It doesn't make you understand the heart better. That's my point. So it just makes you not be able to rattle off names at cocktail parties of sections of the heart. So let's go through this. I'm going to share my thing. And Miss Hunter will keep you entertained with fun facts on the side. So if I get boring, just read her stuff. If some of it's not so good, come back to my stuff, go back and forth. I'm totally fine with that. Especially because I feel like we've covered the most important stuff so far. And then we're going to get to the test. I'm going to give you guys time to get to the test. That's part of the reason I'm kind of rushing this a little bit. But I don't feel like I'm rushing in the sense that we're leaving anything out. Okay, so please ask questions or interrupt me if I'm moving too fast, because I feel like I'm kind of reviewing at this point in a way. Doesn't mean you should know it all, but my point is I'm kind of reviewing and filling in little areas I might have left out yesterday. So your heart is around because it has to pump nutrients to cells, because cells can't go get nutrients for themselves. Most of your cells in your big toe are stuck in your big toe. Most of your cells in your nose are stuck in your nose, and you've got to bring the food and oxygen to them, and you've got to take the waste products away from them. And your heart and your veins and your arteries pump all that stuff around your body and do that for you. That's the whole point of the circulatory system. Yeah? Good. Arteries, farteries, out, away, awateries, are tubes that take blood away from the heart. Veins, ins take blood into the heart through tubes. Capillaries are the tiny little ends of veins and arteries that kind of connect the two, where blood leaks out and feeds the cells, and waste products leak back in and go back up to the heart. That's it. So really, your cardiovascular system is made up of your heart, arteries, veins, and capillaries, and blood. Heart, blood, arteries, veins, capillaries. Heart, tubes, and the stuff inside the tubes, blood. It does help with your protection. It carries around white blood cells, by the way, which is part of your defense mechanism, your defense system. But it also transports all sorts of food and waste and anything like that. When it says here that it combats hemorrhage, hemorrhaging is when you bleed. Hemorrhaging means an escape of blood. If I cut you, you are hemorrhaging. If you get in a bad car accident and you're bleeding inside, that's hemorrhaging too. And clotting is what your blood's supposed to do, where platelets come along and seal up that hemorrhaging and save your life, hopefully. But a really bad cut, that doesn't work. Your blood always seems to be red because when you've seen it, it's picked up oxygen. It's got iron in it. It's got something called hemoglobin, that along with that, it's an iron-based substance that picks up oxygen. And blood becomes very red when it's oxygenated. It becomes, we think it's blue because of the way it looks through our skin, but it's really just kind of a dark red or purple when it doesn't have oxygen. So inside your body, in the veins coming back to your heart, it looks very dark because it doesn't have oxygen in it. Most of your blood is really actually not blood cells. Only about half of it's blood cells. The other half is plasma. Plasma's kind of got water and nutrients in it that help your blood move around. You can go to the hospital and get plasma if they think you're low on fluids alone, and it kind of increases your blood volume, but they haven't put any blood cells in you. They've just increased the water in there, essentially. Very important water, by the way. It's got other kinds of nutrients in it. Hematopoiesis. Hematopoiesis means blood cell production. And we all know where this happens. It happens actually in the skeletal system. This is why all the systems fit together. It actually happens inside the center of long bones, especially your femur, in the bone marrow, where hematopoiesis makes red and white blood cells. There are three types of blood cells: erythrocytes, which are red blood cells, leukocytes, which are essentially white blood cells, and thrombocytes, which help with clotting. blood plasma is mostly water. I already said that. That's why it's important to stay hydrated. It does have some other things in it to help you with clotting, but it's mostly water. There are lots of different types of leukocytes or white blood cells essentially, but they're all meant to kind of fight off infection. So again, you've got erythrocytes, which are red blood cells. Those carry around oxygen. Thrombocytes help with clotting. They're your platelets that help you clot. And leukocytes are all your white blood cells. There's a whole bunch of different types, and they fight off bad guys. I already said this, but erythrocytes, the red blood cells, they contain hemoglobin, which is an iron-based substance. It's actually what makes the blood look red when it picks up oxygen, and its whole job is to pick up oxygen and carry it to your cells. Leukocytes are your white blood cells, and they defend the body against foreign invaders. That's their job. They're little ninjas that go around your blood, and they catch stuff that doesn't seem like it belongs there, and they get rid of it. And sometimes stuff that doesn't belong there gets in there. And I just call them white blood cells. Thrombocytes are supposed to be the self-sealing part of your blood. They're very jagged little cells that actually clog up on purpose and help seal clogs inside your body and outside your body. Inside your body you do rupture actually. Stuff happens all the time. Tiny ruptures, and thrombocytes seal them up all the time without you knowing. Thank goodness. You know? I'm laughing because there's guys moving chairs back in the class, and they promised to be quiet, and so they literally came in tiptoeing while they're carrying chairs. Sorry, I'm easily amused. I just think it's very nice of them. Anyway, so they're like thieves, but they're bringing stuff back. Anyway, essentially, thrombocytes are connective tissue. They make a little lattice network. All connective tissue is like that. It connects, and that's how they seal stuff up. They're fibrous. They're connective tissue. When your blood dries and you get a scab, whether it's inside or outside your body, it's coagulating. That means it's drying and thickening, and it's doing that to seal itself off. There are blood types. There are blood types, and we've heard of these before, whether you're A, B, OB, AB, all that kind of stuff. The thing to really remember about blood types is the reason they're important is that your plasma contains antibodies to look for blood that's not your own. And if it doesn't match up, your body will attack that blood. And so if you're type A and we give you type B, your body recognizes type B as a foreign invader, and it will attack its own blood, and that can kill you. So if you're type A, we need to give you type A. There are some exceptions to this, and the two exceptions are kind of good to know. So type AB is what's called a universal recipient. If you're type A, B, you're in luck. You can take anybody's blood. Good for you. It's actually a great way to be. Because if you get in an accident or something like that, I can give you my blood. It doesn't matter what type I am. It doesn't matter. You are a universal recipient. If you're a type O, you can't take anybody's blood, but you can give blood to anybody. So if you're a type O and you go to the American Red Cross and offer to donate, they love you. Because your blood is good everywhere. Yeah. So AB can take from anybody. O can give to anybody. That's it. And all this
I kind of have an interesting fact about blood.
What'd you say?
I kind of have an interesting fact about blood.
Yeah, please.
For women, if they're O negative, when they get pregnant, unless the baby's O negative too, their body attacks the baby because their blood type doesn't match. But it's only O negative blood types.
Wow. Yeah.
Yeah.
That would be a problem.
Yeah, so they have to take injections and stuff when they find out.
Yeah, and they probably take injections to reduce their immune system so it doesn't fight. Yeah. Which is a weird situation to be in because you don't really want to lower your immune system, but you need to lower it for that situation. Interesting. Very cool. You guys are like...
I also have a fact.
Of course you do, Miss Hunter. Now, what is it?
Also, Yana, that's a really good one. I didn't know about that one. No, I was just gonna say about regarding the blood types as well. Back in the day, before they even knew blood types were a thing, because you could probably imagine before they even like looked at like actual types, they probably were just like, it's all blood. So before they knew that, they actually experimented with the doctors. They experimented with transfusions with blood from animals, and it didn't go well.
But it makes sense. I would try that, right? If I didn't know what we know today.
Right.
Like most of the stuff we learned the hard way. And you'd be like, yeah, look, it looks the same, smells the same, tastes the same. Like, let's put it in there. Right? Yes.
Right.
Very interesting. Cool. Well, and also remember back in the day we used to bleed people too. If we thought you were ill, we thought, let's get the bad blood out of you. Which, if you're sick, getting...
So that's funny enough, that still occurs today. Like, doctors are still doing that. And there's an actual, disease out there that the blood, if it's too much iron, you actually have to do bloodletting.
Right, to get the blood out.
Be with leeches, but yeah.
But they're not doing that with leeches, and they're giving you a transfusion to put back in blood too, I believe, at the same time. But yes, yes, that's true.
Is that chelation or chelation?
Is that
with iron in the blood?
I don't know. Chelation?
Yeah.
It could be, but I don't know.
Okay.
I feel like I'm the student today, and you guys are the teacher. So
no, that's probably it, Miss Monreal. Like I looked it up, but I didn't try to sound it out. I was just like, oh, that's cool, and then that's it. So I think that's probably the word for it. Yeah.
Yeah, I have a friend who has to have those treatments every so many weeks.
wow, interesting. Okay. All right. Wow. Moving right along. So I already explained this, but a recipient is a person who receives blood, and a donor is somebody who gives blood, donates it. We already said universal recipients are A, B, and universal donors are O. Boom. We've already talked about the heart. It is a hollow muscular pump.
I have a question.
Yeah.
So, what is that B positive, A positive, O positive, O negative? What is the positive and the negative thing means? For me.
What? Wait. So what? So you're not asking about A positive. Sorry, you're not asking about blood type. You're asking about just the positive part.
Yeah, or the negative. What is that? What does it mean?
Oh my gosh. I don't completely know, but it has to do with you either, if it's positive, it has a component of the person's blood, and if it's negative, it doesn't have this component. And it has to do with antigens in the blood. So maybe one of you can explain this better than me, but your blood has identifiers on it, antigens, or actually it lacks antigens, so that your body knows that it's not a foreign invader. And if you're O positive, you have this certain antigen, or if you're O negative, you don't have this certain antigen. And it's a way for your body to recognize things. Antigens help your body recognize what are foreign invaders or not. And so the positive and negative is telling you if it's got this particular antigen or doesn't have this antigen. So essentially, like A positive has the A antigen and A negative doesn't have the A antigen.
It's like your blood has a fingerprint.
Yes. And they're saying, but not having that fingerprint can help your body identify it too. So positive would be having the fingerprint, and negative be not having that particular fingerprint. And yes, this is also your body can identify foreign invaders and know what's its blood and not its blood. Did that help? Ms. Torres? Are you there? You're there, but I can't hear you. Did you freeze?
Yeah, kind of. Not really. It's okay. Figure it out.
You're so.
Just kidding.
So, let me explain better then, because you deserve that. All right. When your body has blood flowing through it, one of the most dangerous places to get disease in your body is in your bloodstream. Because it's going to go everywhere. And yet your bloodstream has to go everywhere. And so your blood cells have identifiers on them. Your blood cells have identifiers on them. And you have different identifiers. A positive, A negative, B positive, B negative, all that kind of stuff. And your body can identify based on these things on the outside of the cell that let it know if it's one of its own cells or not. And so negative and positive have to do with what identifiers are on the outside of the cell so that your body can recognize it and know if it's a foreign invade or not. And if those identifiers don't match up right, it says there's a problem here, this is not my blood, and it attacks it. And so A negative means that that particular identifier is not there, but there's other stuff there that lets it know it's there. It's like a key lock, and it knows what stuff is there, and it can identify the blood. That's my best explanation. Anybody else have a better explanation of that? I see Miss Yana. Yeah, go ahead, Miss Yana.
Okay.
You gonna say something, Miss Giannis?
No, I think she said she's good, so.
Okay. All right. All right. So.
Well, I think you're good, but I don't want to embarrass you. I'm joking.
Miss Morel, you often do. So go ahead.
No, I was totally joking.
Okay.
I just wanted to say that.
I don't know exactly how the identifiers work. That's the problem. But I do know that it has to do with announcing whether an identifier is there, and if it's not there, and then it looks at all those identifiers, it can actually recognize a cell. And positive and negative have to do if those identifiers are there. But even if they're not there, their absence of them lets you know that there's something, if you're missing A, that can also be all your cells are missing A. And that lets you know that that's still one of your cells. If A is always there and all your cells always have A, that lets me know it's one of my cells. So it's a way of identifying cells. And my body knows what it's looking for, and if it doesn't find the right identifier, it will start to attack the cells. Yay. Okay, move right along. Okay. You do have a connective tissue sac around your heart called the pericardium. And it's a two-layered sac. It's really like a plastic baggie around your heart with another plastic baggie around it and a little bit of fluid between the two plastic baggies. Why would you have that? Anybody? Nobody?
I don't know.
Well, it protects your heart.
Protects what?
Your heart.
Yeah, it does, and it protects everything around it. The real reason is friction, everybody. If your heart is, everything's packed really tight in your chest, and if it's beating all the time, it's rubbing against everything else. Well, if you've got a plastic bag over that with fluid and another plastic bag over that, that's what rubs. The two plastic bags with the fluid between them rub, and it keeps your heart from rubbing against everything else in your body. And it's called the pericardium. It's a double-walled sac with fluid in it. And it's meant to keep down the rubbing, the friction in your chest with your heart.
Are the two sacs both called pericardium?
Yes.
The whole unit?
Yeah, the whole unit is called pericardium, and it's both sacs. Yes, ma'am. And so you've got a sac around the heart, and you've got a sac here, and it really would be like if I put my fist inside a paper bag, a plastic bag, sorry. I put a little bit of oil over that plastic bag and I put another one on top of it. That would give so much lubrication that whatever's on the outside wouldn't rub against whatever's on the inside. It works really, really well. And its main job, yes, it protects the heart and the organs around it, but it's really protecting them from rubbing. Of course, everybody, of course, there has to be 3 layers of the heart, because we seem to like 3 layers of everything, right? 3 layers of skin, 3 layers of fascia around the muscle, 3 layers around the nerves, 3 layers around everything. Just like you have an epidermis, you've got an epicardium. The middle layer is called the myocardium. Do you guys remember what myo means?
Is that muscle?
Yes, myo means muscle. So this is actually the muscle part of the heart. It's the middle layer, it's the thickest, it's the myocardium. And then the last layer is called endocardium, which shouldn't surprise you. We have that around muscles, right? Endomysium, endocardium. And that's just an epithelial tissue, which is the tissue that lines the insides and outsides of body cavities everywhere. It's one of your 4 main types of tissue, and it lines the inside of the heart. The heart is still a muscle. The main layer there is the myocardium, which is the muscle. There's just an epicardium on top, which makes sure it's got lots of blood flow going to that muscle, and an inner lining on the inside to kind of seal it up, which is the endocardium. Boom, boom. I started, by the way, putting boxes. I put these boxes around these words in this slide because I was like, oh, I'm going to highlight the important stuff. And then I realized I was putting boxes around everything in the slide. Because you really should know, the right atrium and the right ventricle and the left atrium and the left ventricle. And you really should know the left pulmonary veins and the right pulmonary veins and the superior vena cava and the aortic arch. The aortic arch, by the way, is what's coming out of the left ventricle. I know you don't see it clearly here because it's in the back of the heart, but that's the big aorta. That's the big garden hose that comes out of the left ventricle. And it actually curves up like this, the aortic arch, and some of it shoots off to your head and your arms, and then the other part starts heading downstairs to go to your stomach, go to your intestines, and go to your legs. Feed your whole lower body. So we've already talked about taking a picture of your work. That's good. Okay. Good job, dude.
Thank you.
They did such a nice job. They took a picture. I don't know why I wasn't in the picture, but okay. We talked about the right and left atrium, or atria. They're up at the top. We talked about right and left ventricles. We talked about the atria feeding the ventricles. Oh, sorry. I was claiming the heart pumps 2,000 gallons of blood a day. Your book says 1,900. I'll give it to him. We talked about how there's 2 different valves between the atria and the ventricles, right? They're still atrial ventricle valves. They're slightly different on one side than the other, right? And so the one on the right side is a tricuspid valve, which means it's got 3 flaps that come together. The other one is a bicuspid valve. And a lot of people call it the mitral valve because when you have 2 flaps that come together, it looks like a bishop's hat. And that's how it got the name. Cool? We talked about other valves, semilunar valves. These are valves coming out of the heart. If they're going up to the aorta, it's an aortic valve. If they're going out to the lungs, pulmonary means lungs, they're pulmonary valves. These are all just doorways in and out of the heart to make the pump work. I actually kind of mentioned this a little bit yesterday. The lub-dub sound that your heart is making is from the atrial ventricular valves pumping, and then, more simply put, the atrium pumping, and then the ventricles pumping. Because your heart pumps upstairs, and then it pumps downstairs. And that's really the lub-dub sound that you hear. It's actually the valves flapping that that make that sound, but still, lub-dub. That's a good heart. Heartbeat, yeah, heartbeat of 50 to 80 beats a minute is fairly normal. 50 is pretty low. It's not terribly low, but it's pretty low. It shouldn't be above 100 when you're resting, and you don't want to go much lower than 50 when you're resting. By the way, when you're exercising, if you're a healthy individual who's really, really in good shape, and you're exercising, it can safely go up to about 200 beats a minute. We are not going to talk about stages of heart cycles. This has to do with how blood flows through the heart. They are not terribly important. We actually talked about them yesterday. They just give names to all those stages where the blood's coming out of the atrium and going over here and all these different things. Oh, I did mention this yesterday, and I've mentioned it again today. Both the atrium pump together into both the ventricles, and then both the ventricles pump together. It's because it really all is one big thing, so it goes pump, pump, lub-dub, lub-dub. We're not going to get into all this because we already talked about it, which you'll be glad about. Don't forget this, everybody. Most arteries and veins are named by nearby structures. We talked about this in the very, very beginning of the course, but most veins and arteries are named by nearby structures. And so, if you have an artery or a vein in your arm, your brachia, it's often called the brachial artery or the brachial vein. If it's in my right arm, it's the right brachial artery or the right brachial vein. I tell you that because you're never going to want to go around and memorize all the arteries and veins. But this way, if somebody tells you something like the femoral artery or vein, or the left femoral artery or vein, you know at least that they're talking about an artery or a vein in their left leg, their femur. Does that make sense? Super easy peasy.
Mr. Tapscott?
Yeah.
Was that the saphenous vein that you were trying to remember yesterday?
Yes. I think it's the saphenous vein. I think you're right. It's really thick and it's in the thigh, in the inner thigh.
Yes.
Yeah. And they often use it for when they need a vein, when they have to seal a vein to sew it to your heart because you got problems. I think it is the saphenous vein. Yeah. How'd you know that?
When I was doing my homework, I saw the femoral, which is what I asked you what it was, and then you said, no, not that one, the other one, and then so I noticed that it was there.
That pretty much sums up my knowledge. I'm like, no, not that one, but it's the other one, but I don't know the name of the other one, but not that one. Yeah, that's very true. Good. I think we'll actually get to the saphenous vein here eventually. I'm assuming they go over that. Anyway, just don't forget to kind of use common sense. So if somebody says brachial blah, 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 they're probably talking about a vein or artery or nerve, depends on what they say after what the blah, blah, blah is, in their brachial region, in their arm. This stuff is important. These are definitions that are important, and I did not mention them yesterday. Okay? Lumen is the space within a blood vessel or a vein or an artery. That's not, I mean, the concept is important, but lumen's not so important. But vasodilation and vasoconstriction are very important terms, as well as hyperemia and ischemia. These are very important massage therapist related terms. So right now you should be like, I'm taking these down as notes because you're telling me they are as important to massage therapists, meaning massage therapists use these terms a lot. To dilate is to get bigger. When you vasodilate, it means that your veins and or arteries are getting bigger. That's vasodilation. Your body does it all the time. If I start running, my body will vasodilate the arteries and veins to my legs to get more blood in them so I have more blood to run with, because that's where I need it. If I get scared, my body will shoot adrenaline into my body and vasodilate all the stuff going to my arms and legs in case I need to run or fight. That's what it does. You also vasoconstrict all the time. Constrict means to close in, like a boa constrictor. Vasoconstriction happens all the time. If my core temperature, if my body feels like my core temperature is getting a little bit cold, it will vasoconstrict blood to my arms, not give my arms as much blood because I don't need to keep them warm, and keep that blood inside to keep me warm. You vasodilate and vasoconstrict all the time. Vasodilate, vasoconstrict, and your body does it because you have smooth muscle around your veins and arteries, so you can actually control the size of your tubing. It's amazing. And by the way, if you cut yourself, your body does try to save your life. It realizes there's a huge blood loss here, and it starts to vasoconstrict the artery that you cut to try to slow down the amount of blood coming out of it. The problem is it can't shut itself off, but it will slow it down. So you'll try to blood clot, you'll vasoconstrict and try to stop the bleeding. Very, very important. Vasoconstriction and vasodilation are important concepts to know about. Some of you were rubbing people's backs yesterday in lab, and their skin got very red. Because remember we said you increase circulation with rubbing because of the sponge effect we talked about? Yeah? Well, you were creating hyperemia. You are creating hyperemia, which is increased blood flow to an area, and it usually shows up as redness and the skin gets warmer there. And it is a good thing. You've probably heard Mr. Ibarra even use this term before. He'll be like, that's really good hyperemia there. I don't know if that's how he talks, but he'll say something like that. He'll be like, oh yeah, you got some hyperemia going there. That is a very common massage therapist term to mean you got blood flow going to the area. It's red and hot in a good way. That's hyperemia. We're usually shooting for hyperemia. So this is a common massage therapist term, which means you've gotten the area to increase blood flow. Now, by the way, some of you display hyperemia through a vasodilation in your face when you get embarrassed. You get embarrassed, and for whatever reason you vasodilate, blood flushes in your face and it turns red, and you actually have hyperemia in your face, and we know you're embarrassed. That's another example. Then there is something called ischemia, and ischemia in general is not good. Ischemia is lack of blood flow to an area. The area feels cold, it looks pale, could even start to look blue. That is ischemia, and that is lack of blood flow to an area, and it's in general not a good thing. Right? And those are just very common massage therapist terms. You know, I tell you lots of stuff where I'm like, you're going to need this for the test, you're never going to need it again. This stuff you should know. Like, it's a term that you will hear in your career quite a bit. So, vasodilation, vasoconstriction, vasodilation, vasoconstriction, veins dilating, veins constricting, arteries dilating, arteries constricting. Hyperemia, lots of rubbing, getting all warm, lots of blood, hyper! Ischemia, nothing going on there, lack of blood to an area. Cool. You all have a pulse, I hope. Right? On Mondays, sometimes I wonder, but today it's looking pretty good. And you all have a pulse, and that pulse is literally coming from your heart beating, right? Most correctly, it's coming from your left ventricle beating, because when your left ventricle beats, that's that big push, and all of a sudden, pulse. And actually, your arteries are actually pulsing, because they're getting a flush of blood in there. And that's your pulse. You have lots of pulse points in your body. We're used to the one of the carotid artery that people always check in the movies to see if somebody's dead. I always crack up too because they go like this. They go, oh, he's dead. And I'm like, that wasn't really long enough to really make sure there's a pulse there. But anyway, that's one. We were in lab the other day with somebody. I'm sorry I don't remember who, but we could feel their pulse in their stomach. That's because the abdominal aorta, it's huge, and we could feel it in them. You can sometimes feel it in people's hips, their inner thigh, down by their ankle. I actually have a little artery down in my ankle, and I can watch it go like that. Anyway, those are just pulse points. No big deal. I do want to talk to you about blood pressure, though. Blood pressure. You're not going to be taking anybody's blood pressure, but I want you to understand it. This is considered a pretty ideal blood pressure, 120/70. And literally the way that your blood pressure is taken is they put a cuff around your arm to seal off your arm, and they see how tight they have to get it to stop your pulse from coming through your arm. So how hard do I have to squeeze your arm to stop getting a pulse down here? If your blood pressure is really high, I have to squeeze really hard to stop getting a blood flow down here, getting a pulse down here. And that's really what they're checking when they put a cuff on your arm. They're checking how much pressure is going through your system. And you've got two numbers, systolic and diastolic. This higher number is the higher pressure number, and it comes from when your heart beats. When your left ventricle beats, a lot of pressure comes out of it and it flushes through your body. After that beat is done, you still have pressure in your veins and arteries. Still have pressure in your arteries, sorry. And that is your diastolic pressure. That's your diastolic pressure, and that's your arteries at rest when blood isn't being forced through them. Which one is a more important indicator of health? Systolic, the top one, or diastolic, the bottom one?
I think the top one.
Top one. Why do you think that?
Because that shows how much blood is rushing to the body.
Sure, I can see that. So it's important.
The pressure of it.
Yeah, it gives you an idea of just the pressure of the push. And is it working? It's a good argument. Do we agree with Ms. Torres? What she's saying is highly intelligent, but with all due respect to her, she's wrong. So, but I really appreciate Ms. Torres for being the one person to answer. This does tell you the push to the rest of your body, and that's very important. This one down here tells me the efficiency of my system. If I have really high blood pressure when I'm not pumping, which is that low number, it means my pipes are really having a hard time carrying blood through them. And so in many ways, the lower number is the more important number, because it tells me how efficiently my pipes are. So the top number being high is actually not that big a worry. Sometimes it goes up high when you're exercising, things like that. It's the lower number, your pipes at rest. If your pipes at rest still have a lot of pressure in them, it means they're probably clogged up and things aren't getting through them well. We'd like this bottom number to be low. We really would. When this bottom number gets even to 80, most places consider that the beginning of high blood pressure. 90, it's high blood pressure. Above 90, they start to really worry. And it's this bottom number they worry about. This top number usually goes up with it, but it's the bottom number they worry about. And you'd like it to be around 70. You'd like it to be around 60 if you could. It's very unusual in our society, but I do know people with blood pressure 110/60. Yeah. If you exercise, aren't overweight, don't drink, eat really healthy foods, you don't stress, 110/60 is very achievable, but it's unusual. So anyway, the diastolic pressure is actually, ironically, the more important one on the bottom. Ms. Torres is right that the top pressure tells you how hard your heart is pumping. So I like her logic. Again, Mr. Kandaris told us hyper is high blood pressure, hypotension. Hypo is low blood pressure. And again, Mr. Tapscott said, low blood pressure, hypotension, is a relative contraindication for massage, meaning proceed with some caution. Not in how you massage them, but really how they get up from the table, which Ms. Yanez also concluded today from her presentation. So we've now had several people tell us, just be cognizant, be aware of low blood pressure, not the way you massage them, but the way they get up from the table. We don't want people getting lightheaded and passing out. That's it. Cool? All right. I already talked about it yesterday, but capillaries are at the end of all your arteries and veins. It's when they get really teeny. And they're so teeny that oxygen can leak out into the cells and CO2 can leak back in and get back into them, and nutrients can come in and out. That's their job, is to get that thin. They get down so thin, by the way, they're a single cell wall, and so they actually leak. And they're supposed to leak on purpose at that point. I don't think your body talks about this, but I mean your book talks about this, but I think it's important. Your veins, remember veins are going in, they're going back to the heart. They have one-way valves in them. They have one-way valves in them, and part of the job of the one-way valve is to make sure the blood doesn't flow backwards and pool in your legs and such. So they got one-way valves that hopefully, as blood gets pumped back up to your heart, it doesn't flow back downhill. So arteries do not have one-way valves in them. They don't need them. There's so much pressure going through them, it doesn't matter. But veins have one-way valves in them.
What is a good heart rate?
What is a good heart rate at rest?
Heart rate for adults, right?
Oh. Thought you were asking me, Miss Torres. You're asking like Google. Yeah. Heart rate at rest, by the way, everybody, is probably 50 beats a minute to 80 beats a minute would be a good heartbeat at rest. This is important. Skeletal muscles can act as a pump to help venous return. Super important. Skeletal muscles can act as a pump to help venous return. The action of my muscles working, or you working my muscles as a massage therapist, thank you very much, pumps blood back into my system and helps the venous return, helps the veins get filled back up, helps blood get back to my heart. You massaging my legs or me using my legs helps blood not pool in my legs. It helps it get back to my heart. I was very delighted yesterday when basically everybody I asked knew the 3 calf muscles, and I'll tell you why. Everybody I asked basically said gastrocnemius, soleus, and plantaris. Does anybody know the nickname for the soleus? The soleus is nicknamed the second heart because it is believed that the action of using your calf muscles, especially the soleus, which you use when you walk and do calf raises and anything with dorsiflexion, plantar flexion, anything with plantar flexion, the soleus is activated, and it's a very thick muscle, and there's a lot of veins down in there, and it acts and creates a pumping action which helps to pump blood back up to your heart, and it's called the second heart. I remember this by heart and soleus. Heart and soul. Soleus is the second heart. Heart and soleus pumps blood back to your heart. Why is this important? Because if you get up and walk every once in a while, you actually help that blood not pool in your legs, and you help prevent things like varicose veins and all these problems we talked about. Walking is one of the best things you can do for yourself. Soleus, second heart, heart and soleus, because skeletal muscles act in a pumping action to help get blood back to your heart. And massage therapists rubbing and squeezing your body on your skeletal muscles create a pumping action that helps blood get back to your heart and increases circulation. We talked about this yesterday. But both whether the person does it, I think it was Miss Hunter and I that were talking about this, whether the person does it running around the block or whether we do it, we are increasing circulation. Bum, bum, bum. There is something called postural or orthostatic hypotension. Orthostatic hypotension is a very fancy name, but it means when my body is static and not moving, I get low blood pressure. Orthostatic hypotension happens with lots of people, and it means when they're laying down the table that their blood pressure kind of drops, and those are the people when they sit up, they tend to get very dizzy. So orthostatic hypotension is a sudden drop in blood pressure. And it can happen from getting up from a massage. Yes. It happens to some people when they get really scared, by the way, a big sudden jolt, and they can kind of get orthostatic hypotension and faint on you. But it just means when the body doesn't move, low blood pressure. We are not going to talk about those at all. We're not going to talk about those at all. Actually, we are a little bit. Let's see. No. Yep. Okay. That's it. I'm stopping there.